of Medicine, where she focused on international residency training and health workforce capacity. She is an active member of Physicians for Human Rights and is a voluntary faculty member at the Mount Sinai Human Rights Clinic and Weill Cornell Center for Human Rights, aiding victims of female genital mutilation, domestic violence, and sex trafficking in their applications for asylum in the United States. Dr. Lieb is also a voluntary physician for the East Harlem Health Outreach Partnership, which provides care to uninsured, undeserved women in East Harlem. Now, Dr. Lieb will provide some introductory remarks, which will be followed by a Q&A session. Let me just admit this person in. And Dr. Lieb, thank you for making time to join us today. And if you could start by telling us a little bit about your childhood, where you grew up, and what experiences made you want to initially pursue a career in medicine.
Sure. Good evening, everybody. I'm Whitney. And as Akash said, I am an OBGYN at Mount Sinai Icahn School of Medicine in Manhattan. I grew up in Marin County in San Anselmo. And I was always interested in how the body worked. And so I was always interested in medicine, but I didn't really know if I wanted to be a doctor, because everybody says they want to be a doctor and a lawyer and when they grow up, but what does that mean in terms of what you want to do with your life? And is it more paperwork than actual just saving lives, or how does it really work? So I think I started volunteering like you guys did in high school. I worked in like a radiation oncology department, and I helped facilitate cancer patients and their radiation. I learned how radiation worked and all the physics to it, which I had no idea. And I continued to be interested in medicine. And so I went to college at UC Berkeley, and I got a degree in molecular and cell biology. And I really liked science and medicine, but Berkeley was really hard, and I wasn't sure if I was kind of a bit burnt out afterwards, and so I wasn't sure if I wanted to go to medical school right away. And so I started working at UCSF while I was an undergrad at Berkeley in allergy and immunology, and I liked how it was, but I thought maybe I'd want a research career and maybe go get a PhD instead, because it just seemed a little bit less competitive in terms of applying to medical school. And so I finished my degree at Berkeley, and I actually decided to do continued clinical research. So I worked on NIH trials for kids with pediatric liver disease, and I really liked that. And so I did that for a couple of years, but then I finally decided that medicine and medical school was the right decision for me. So I went back to school. But it took me a while to figure out if I really wanted to be a doctor, because I wanted to make sure, since it's a lifelong career, it doesn't have to be, but I didn't want to go all through medical school and residency and then realize I didn't want to be a doctor. Is that helpful as a background?
Yeah, that's great. So what we're gonna do now is invite some of our officers to pose some questions to you. So if each of you guys could introduce yourself by name and title, and then go ahead and ask your question. We'll start off with Ashley.
Hi, Doctor. My name is Ashley, and I'm the Director of Public Relations here at YMS. And my question for you is, you initially graduated from Berkeley and then did a master's at public health at the University of New England before your medical degree at St. George's. So the question is, can you tell us how you decide what degrees to pursue and to support your career?
Sure. So while I was working at UCSF as a clinical research coordinator, I decided that I wanted a master's degree in order to get a better idea of public health and what that means in the American healthcare system. And it would be really helpful for my career in that way if I didn't decide to do medicine. I have to say my public health degree is one of the favorite parts of my education. I think it is a great way to become a holistic doctor. I think not understanding only individual care of patients, but a more wholesome, well-rounded public health education is really helpful. So I know there's a ton of programs that now do MD, MPH programs, and I think if you have the opportunity to do them, I think it gives you a great way in terms of understanding care for patients. I think it's really helpful. So I did that. And then as I was finishing my public health degree, I decided I really did want to get a degree in medicine. And so then I applied to medical school. I had been out for a couple of years, and so I wasn't as competitive as an applicant. Also, as you all know, because you're all all looking to become doctors, perhaps, it's really hard to get into medical school in California, right? So being out a couple of years, I just wasn't as a competitive applicant. So I applied, and actually, I was not thinking I would go to a foreign medical school because I thought I would never be a real doctor if I went to a foreign medical school. It seemed really scary to me after coming from Berkeley. But the fellow in pediatric gastroenterology at UCSF, which is one of the top programs in the country, had gone to St. George's. And so she said, I went there and now I'm at a top university in the United States, and don't worry about it, and you'll become a real doctor and it's fine. So I decided to go. She actually motivated me to go. So I went to St. George's for medical school. And it was a wonderful experience. I got a fantastic education. It was a beautiful place to go to school. I went there for 2 years, and then I finished up my rotations in New York and New Jersey. And so that was my path.
Thank you.
Sure.
Hi, Dr. Lieb. My name is Akarsh. I'm the director of videography. And my question is, are there any experiences going through training or medical school that stood out to you as key learning moments?
Oh gosh, I know. I saw that question is very loaded. So I think there's many. I think when you're a medical student, there's interactions with patients that you find really monumental. This one is a bit different, but I think it is one of my most memorable. There was a woman who had come in, it was on my family medicine rotation, and she had come in and she was complaining about abdominal pain for months, and no one took her seriously. And she said that she was constipated, and like they kind of just brushed it off and just kept giving her Colace and just medicines to help. And finally, the resident and I decided that we would disimpact her, so we would help with the constipation by removing it manually. And it was life-changing for her. She started crying. She was like so thankful. And I know it's a different story, but just to think about how you can impact care when you really listen to a patient and change their life, because for so long no one had listened to her, and so she ended up fully crying afterwards because she had gotten so much relief from it. So I think that was one moment where I realized, as a physician, you can really help people and change how they feel and impact their life. I did a lot of global health work as well when I was a medical student, and I traveled to Nepal, and I learned how to deliver babies from midwives in a very small mountain town, and just seeing the decreased amount of care that women get around the world made a huge impact in my life. And that's why I decided to become an OBGYN, just seeing the reproductive rights of women and the disparity in care that they get was another very monumental episode. I also think when I was a medical student and seeing the lack of care among teenage pregnant women was another big moment for me in terms of reproductive rights and how I decided to go into OBGYN.
Awesome, thank you.
Sure.
Hi, Dr. Lee. My name is Adrian, and I'm the secretary of the club. And my question for you was, are there any critical milestones you've had throughout your career? And are there some things that you still want to achieve?
So I think as a physician, you are a lifelong learner, so there's always more to achieve. I actually, this last Friday, submitted my first NIH grant as a principal investigator. So that was a big milestone for me. As you read in my bio, I'm a clinician, but I'm also really active in research. And so submitting a grant to the NIH is a lot. And being a principal and investigator, it takes a lot of time. It takes a lot of mentors. It's not something you can just like go to the NIH website, be like, oh, I'll apply for this, right? So doing that is was really great. And I applied for a grant to study vaccine hesitancy in pregnancy and lactating women, right? Because we know a lot of people are getting vaccinated, but pregnant women are not getting vaccinated. And now we're seeing that they're getting ICU admissions, and most pregnant women are not having good outcomes when it comes to COVID. So that's one thing I would say is a big milestone. I'm also working on I'm a co-investigator on a CDC grant studying COVID and pregnancy. And so helping to understand the global pandemic in which we are all living in, especially in a vulnerable population such as pregnancy and postpartum, is something also that I think I'm pretty proud of.
Awesome. Thank you for sharing.
Sure.
Hi there, Dr. Lieb. My name is Rahul and I'm the VP. My question to you was, this year YMS, we launched the MedGives initiative, which basically promotes social services. Knowing that you're an active contributor to Physicians for Human Rights and I'm not sure if I'm pronouncing that right, Cornell Center for Human Rights. Can you explain what your role in these organizations are and why you chose to support them?
Sure. So Physicians for Human Rights is a national organization, and then there's medical schools all around the country that participate with the Physicians for Human Rights. So Will Cornell, Icahn School of Medicine. So if and when you guys go to medical school, the Physicians for Human Rights programs are run by medical students, which is incredible. And the main goal is to help clients who are seeking asylum get asylum in the United States. And we know from research that if a physician writes an affidavit, helping to describe their scars or a psychological evaluation with their PTSD from the countries that they have come from, 90% of them have a likelihood of being granted asylum versus like 35 to 40% if you don't have a physician affidavit. So for me, contributing to people escaping a country where they are unsafe and being able to provide that as a document to help them seek asylum is one of my favorite things that I volunteer for. I really enjoy working with the medical students. They really help to get everything coordinated with the lawyer and with other services. So most of the programs around the country will help them with language services afterwards and social services, helping them to get a job, helping with clothing or to get medical care. And all that's provided through the medical school, which is really wonderful. You can do the asylum affidavits on your own. You don't need to work with a medical school. So if you guys decide not to be academics and just to become physicians, you can do it in your office. But it is a really great way, I think, to give back and to help people who are coming from all around the world who feel unsafe. And I think thus far I've worked to help get, I don't know, I think I'm up to maybe like 20 or 25 people to help receive asylum in the United States. And every time I get an email saying like, thank you for your help, it's just so heartwarming to know that you can help someone achieve a better life and to have a safer existence. It's just really wonderful to be a part of. You're not doing the whole thing, but you are helping.
Thank you.
Hey Whitney, my name is Tejas and I'm the marketing director of YMS. And what I wanted to ask you is how COVID has had an impact on your work, your patients, and like some of the setbacks you'd faced.
So that's a good question. I was pregnant during COVID. So I was a provider who was pregnant and working in a COVID unit. And so it definitely affected my life in absolutely every way you could think of. We didn't know a lot about COVID in the beginning, so I was very terrified to be a provider and stepping into COVID positive rooms and being pregnant. So I had a lot of help through my job. And when I started, I had gestational diabetes and pregnancy too, so I had an increased risk. So I soon stopped working on the labor floor because we didn't know the risks and there was no vaccine at the time. And I did a lot of telemedicine. So that was one of the, I didn't work in the COVID setting for as long as I would have wanted to if it was just me, but because I was pregnant, I started to think about 2 people instead of 1. But after the vaccine came out, I was back at it and working on a COVID floor. In terms of patient care, I'm sure if you've talked to other providers, a lot of care has just been stagnant, and a lot of things that we were previously working on have not been happening. So there's been an increase in domestic violence against women. And so not being able to come and see your provider and getting services has been really challenging. There's been a decrease in cancer care, a decrease in follow-up of just chronic diseases that we see all the time. And that's been really devastating for a lot of people. So being able to ramp back up and do all of those things has been, I think, a light at the end of the tunnel. As a provider who worked in New York City, which was the epicenter of when this all started, and we kind of all thought that maybe it was just going to happen in New York City because it was a big clustered environment, but now we see it's happening all around the world. It was really challenging to figure out how to navigate being a doctor and also and becoming a new parent. But over time, I kind of just delve into the research and talk to my colleagues all around the world, saw what they were seeing in order to figure out the best way to navigate it, to not only be a physician, but also a mom.
Right. Also, I just want to ask one more question. I just want to understand this, is that how do you get past like these challenges that you face? Because I'm aware of the fact that the OBGYN is like a place that can bring hope and despair. So like, how do you get past these challenges?
So I think everybody finds their wellness in different ways. I'm actually currently the wellness champion for the residents in the OBGYN program. And so getting people connected with therapy, having a mentor who's been through it before is all really important in order to like continue to go on, right? That's such an important question that you're asking. There are so many devastating things that we see in medicine, and no one teaches you how to cope with that, right? Like you're learning about, you're like so stressed out about your SATs and then your MCATs and then getting into medical school and then becoming a resident. And it's so much more academic. And then you see someone die, or you hold someone's hands as they, learn about a terminal diagnosis, and their medical schools are starting to teach those things, but even teaching them, you still instill until you do it, it becomes really different. And so I think mentorship and therapy are all really important things through your lifelong career in medicine in order to sustain a healthy, happy work-life balance.
Thank you very much.
Yeah, and it's not talked about enough. People don't talk about it. People don't, especially now with COVID coming out, and there's so much PTSD in physicians who've been working throughout COVID, right? And we know that there's so much burnout. And so really connecting people to services and connecting yourself to services is so important. And also having an outlet of how you can relax. So whether that's exercise, whether that's friends, everybody unwinds in a different way, but making sure that you make time for yourself all the time is super important in order to sustain being a physician, because it's a long road and it can be and it has a ton of setbacks. And so really being able to reach out and have mentorship and have a release and have someone to talk to is super important.
Right. That's actually one of the reasons why I'm so hesitant to become a doctor, is because you realize after like all the academic schooling that you have to go through, is that each person's life is in your hand, and if you, depending on how you do, is what impacts them in their life. So I just feel like it's just a really hard process of like how you get past these certain things mentally, because it just not physically drains you, but mentally drains you. So I just wanted to understand from a different person's perspective on how they would face these challenges. Thank you very much.
Yeah, I think another thing to know too is that I think many physicians feel that, a patient's life is in their hands, but it is a team, right? And mostly at the end of the day, you're working with a team of people in order to make people's lives better. There are surgical emergencies that us in the surgical field deal with that aren't so much a team effort in that way. And so finding the way that you want to be a physician is super important. And I think that's a really thing that people don't talk about either. There's so many different ways to be a physician. You know, in medical, like when you're applying for medical school or thinking about medical school, like I'll be an internal medicine doctor, a radiologist, or a surgeon, right? But there's fields of medicine that, I mean, I'm not even really, you know, that aware of in that way, where people are doing biomedical engineering and they're getting an MD, PhD, and they're not dealing with death and dying patients, right? So there's all different ways to enter the fields. And I think the other important thing to know too is that once you get into medicine, you can be, it may be that you do not want to see patients die every day. That doesn't have to be the kind of doctor that you want to be. I liked OBGYN because there was healthy people who were just pregnant. So it was nice to see healthy people as well as people who were sick. For me, that's a good balance of just, instead of just seeing sick people all the time, right? So you don't have to know all of that before you go to medical school. And there's so many different ways to enter medicine and to be a doctor. You could be a preventative medicine doctor, right? Like there's all different ways to enter the field. And once you get there, to go in different paths. For me, I totally agree with you. It can be really exhausting. And so that's why I like the combination of I'm 50% research and 50% clinical. So I get to be academic for half of my week, and then I get to see patients for half of my week and work with residents and do teaching. And to me, that's a really good balance. I could not see 40 patients a day every day. I would be exhausted. But some people, that motivates them, and that's what gets them excited about medicine, right? So you just, along the way, and you don't have to know this now, you'll figure out what ways that medicine makes you want to keep getting up and going to work the next day.
Thank you very much.
Hi, Dr. Lieb. My name is Tumin, and I am the fundraising director. And you've kind of touched on my question, but during your career, you encounter a lot of stressful situations when delivering babies. Can you tell us how you manage your stress and any anecdotes from experiences you have had in the past?
Sure. So I manage a lot of my stress, I think, with mentorship and talking to senior faculty who've done it before, right? Because they really have been helpful in terms of how you deal with that stress and how you deal with a patient who has passed away or a bad fetal outcome, which are really hard, right? When we lose a baby on the labor floor, that can be very, very difficult for everybody. And so debriefs are really helpful, I found, in order to talk about what have happened, but to have someone that you really trust and think is a good physician to talk it out with has always been the way that I have dealt with bad outcomes in that way. Exercise has always been really great too for me. That's a really great way to just get out of my head and just take a moment to just step back and think about what's going on. But I would have to say overall, that having a great mentor has always helped me with really difficult outcomes.
Perfect. And then are there any interesting stories or particular like anecdotes that you recall from these experiences?
Yeah, I think when I was a resident, I lost my first mom to a PE. And that was like very difficult for me because I hadn't really lost a patient that I had taken care of every day because she was on the antepartum service. And so I just saw her every single day. And that was really difficult for me. And so you think that other people haven't gone through it. And then you start talking to more and more people and they share their experiences. And that has been was really meaningful in a lot of ways. So that the chief of the gynecologic service and the residency director she's been a physician for I don't know now, probably like 30 years. And you just, when you're a resident, you think that everybody knows more than you do, and that you don't know if you'll ever get to be the type of surgeon that they are. And that's how I thought about her. And so I never thought that she had gone through anything like this in this way, because I just felt like she was someone who's already done it all, And she had told me about an experience where she had a person in the SICU, and she went every day to see them because it had been such a poor outcome. And she had lost her hair and had lost weight and all of those things that had happened to her because of the stress of the situation. And after that, that experience, you knew that there are different ways to handle stress, but just hearing that people do go through these hard situations and it's something that everybody experiences makes you not feel so isolated in terms of those really hard moments, because there are very difficult moments in medicine, and it's really important not to make sure that they don't change you for the worse, because they will change you, but you want to continue to be a good doctor and to continue to wake up and go to work in the morning.
Thank you.
Hello again. I just wanted to ask one more question. So, I believe you said, correct me if I'm wrong, I believe you said that you worked as a midwife at Puerto Rico?
No, so I went to Nepal and I learned how to deliver babies from midwives in Nepal.
Right. Could you just like describe how like the conditions in Nepal, like the healthcare conditions in Nepal were differed from healthcare conditions in America? So like,
so many differences, but yeah, so I was in a mountain town, and so there was no physician that worked there. They had a small lab where they could do an x-ray and look, which was really fancy, and they had a microscope, and then they had midwives, so the women would just come in and deliver babies. However, if there are any complications, they would go down on a motorcycle in order to get care in Kathmandu. So it was like very limited services in a very rural area, which, to be honest, happens in America too, right? There are places where there are no physicians, there are no doctors to deliver babies, and stuff like this happens in the United States as well. And so care, the interesting thing about medical care is that it's different everywhere, and but then there's similarities with the US system as well, right? We have very rural parts of America who are not getting any type of care that they need, whether they're too far from a doctor or the government has restricted their access on different types of care. And so sometimes it doesn't look as different as we think. I've worked also in Uganda and in Liberia, and there is definitely differences in the medical care no matter where you go, but it's interesting to see how care is distributed based on socioeconomic status, and disparities that we see in medicine.
thank you so much.
It was a weighted question, so I hope I did okay, but that's like a whole hour discussion. So I just wanted
Right. No, I just wanted to understand, like, because all the documentaries I've seen show like these conditions that are just like much harsher. In America, there's so many precautions you take. You get weekly meetings and with like your gynecologist and all that stuff. But in like, let's say the more rural areas, you have like a lot less technology, and you have a lot less like access to these healthcare stuff. So I was just like wondering on like how exactly was it different,
Sure, but like, just remember, in America, there are millions of people that don't have healthcare and don't go see a doctor. So yes, every place is different, but you can find similarities, given that medical care is not guaranteed to everybody in the United States in that way.
Thank you.
Yes, thank you. So I had a couple questions as well before I opened up the member Q&A.
Sure.
Just one was for clarification. So I recall you saying something about an antepartum service. So I wasn't really sure what that was. So I was just curious if you could.
Oh, sure. So an antepartum service is when women are pregnant, but they need to be admitted to the hospital for different reasons. So they could have something where their placenta is at the level of the cervix. And so if they continue to bleed, they would need an emergency C-section at some point. And so they stay in the hospital if they have bleeding until they deliver, because you don't want them to deliver at home because they could bleed out. Right, that's one reason. Uncontrolled diabetes, uncontrolled hypertension during pregnancy. If they can't control it as an outpatient, you would be admitted to the antepartum service. There are thousands of conditions that would cause you to be admitted, but it's when pregnant people need to be admitted to the hospital because they can't be controlled as an outpatient.
Oh, okay. Thank you. And then the second
Good
one was,
question. Thank you. Sometimes we forget as clinicians what you guys know and what you guys don't know. So thank you for asking.
Mhm. And the second one was just like more of a general question. So on average, like how often would you say things go bad or like don't go as you would want them to?
Oh, I have no idea. I mean, most days are good outcomes, right? So I don't want you guys walking away with the impression that OBGYN is this death and dying field. It's not. Most days are happy days. Most days, moms and babies are really have a great day. It's one of the most amazing experiences that a family goes through. However, there are some bad days. I couldn't give you a percentage. Everybody has different experiences. I knew a physician who had never had a patient die until he was in his 70s, and that's when he decided to retire. And then when I was a resident, I had 4 patients die in a year. So it's really dependent on, I think, where you practice too. I work at a very high level, high acuity OBGYN department in the middle of New York, right? And if you are working at a low level hospital, you see a lot less because they transfer everything to where I work. So it just really depends.
Okay, I see. Thank you for clarification on this.
Sure.
And just before entering the member Q&A, like the last question that I had was, are there any suggestions or pieces of advice that you can offer to those that are planning to pursue a career as an OBGYN in particular, like things to look out for or kind of tips? I don't know.
Sure. Someone told me this once and I thought it was a really great analogy. It's a marathon, not a sprint. So just remember to like enjoy the rest of your parts of your life, not just focus on MCATs and, residency and all those things. They are all important, but don't lose everything else in your life in the midst of that, because you will burn out. So I think was like a very important thing in terms of just like general medicine, because it is really stressful. All of it is so stressful. I remember being a high school student thinking, if I don't do all my SATs, then I won't get into a good college, and then I won't get into a good medical school, and then I won't get into a good residency, and then I can't be a doctor. That's all really, it's a lot of stress, and you guys are just starting this process. So just remember, it does work out. You can be a physician. There are many different paths to get there, but to enjoy the ride, because otherwise, if you're miserable the whole time, then you get there and you realize I should have taken more time for myself during the process. So that's just general. In terms of being an OBGYN, I would say do as many shadowing experiences as you can, because it's a really hard field. It's both clinical and surgical. The hours can be long. You can find different ways not to have long hours, but it's a hard residency, and it's really rewarding, but you want to make sure that you really want to do it before you start, because it is really hard. And people do, I think it used to be one of the highest dropout rates for residency. Like people would start an OBGYN residency and then just decide they don't want to do it. And so instead of giving yourself instead of not exploring the options before, just go to a labor floor and, go work in a clinic and an office practice and all those kind of things. Spend 10 hours in the OR and see if that's like something that interests you, so that you know what you're getting into. But with that being said, I wouldn't want to do anything else. Like I don't say to myself, oh gosh, when I go down to the ED, I'm never like, oh, I wish I was an ED physician. I don't. It's not something I would want to do, right? So if it's you'll figure it out. If there's nowhere else then you want to be, besides taking care of women, then you'll know. And maybe that changes, and that can change, but it's helpful to get as much experience as you can beforehand so that you're not blindsided and think, oh, this is not what I expected when I got here.
Thank you. I appreciate that.
Yeah.
And so now we can open up to a membership Q&A. So for the people in the audience that are listening, if you can go ahead and just raise your hand and I can pick on you if you have any questions.
And ask as many questions as you want. I think it's really important to get as many perspectives. There's so many different ways that people practice medicine. So you can reach out to me again if you'd like, and just ask as many people and get as many perspectives and shadow as much as you can, to figure out if this is the fit for you. And even it may not be the fit because you may have not found what you wanted to do, but I don't think going to medical school is ever a bad option.
Yeah, so our first question is from Yubin.
Oh yeah. Have you seen Grey's Anatomy?
I have.
Like, how would you compare that to like what you do, and like how, like, I know it's like a bit exaggerated, but like in comparison to what you have seen, how dramatic is it?
There's not an emergency every day. You don't perform all different types of surgeries from all different specialties. You do work that hard. I would say you don't have so much time to sleep with colleagues in the call rooms. That's not something that really happens in residency as much, but the hours and the running around and all of that stuff I think that part's accurate.
Okay, thank you. I really appreciate it.
Sure.
So another question was from Anshul, and she was asking, in high school, what your initial plan was.
So in high school, my initial plan was to go to medical school, which is why I started volunteering in different types of medicine when I was a high school student. But when I got to college and I started doing molecular biology, I thought maybe I could do a PhD instead of an MD and be happy. I wasn't really sure. And I thought medicine might burn me out too much. It seemed like really a lofty profession of taking care of other humans' lives. So that was the original goal. And then I kind of tethered around in medicine and then started doing clinical research, as I had mentioned, and then decided that medicine was for me. But my path wasn't direct because I was nervous about lunging into a career that I wasn't sure I was ready for.
Okay, thank you. I hope that answered your question, Anshul. And if anyone else has any other questions, you can go ahead and raise your hand, or you can privately message them to me and I can ask them for you.
Feel free to ask anything that you would be nervous about asking. I'm happy to answer it.
Yeah, Tejas.
Has there ever been a situation where like you're just driving a car, or you're just like chilling at home or something like that, and there was like an emergency close by and like you had to respond to it as fast as possible? Has there ever been a situation like that?
There's been a couple on an airplane. I've never delivered a baby on an airplane. But there's been a couple situations where they need a physician on the plane. And in the beginning, I used to not offer my services because I don't do heart attacks and that's not my specialty. So unless somebody was pregnant or having a baby, I didn't really feel like I was the person to ask. However, afterwards, I did there was a grand rounds, and I found out that in order to, if someone is having a cardiac arrest or something like that, in order to give the meds, they need a physician on the plane, but there is a cardiologist down that you're talking to on the phone that can help you talk you through the different things that you don't remember the dose of epi, or you don't remember, different doses of things, but they need a physician. So now I always go. I have to say the last time I was called, there was 4 cardiologists on the plane. So I was just like, okay, not needed. But I think if you guys go into medicine, it's good to know, even though it may be out of the realm of your specialty, sometimes they just need an MD in order to talk to another MD in order to help with situations. Oh, actually, and I totally forgot. About a week ago, I was walking out of the hospital and there was a guy lying on the side of the street, and he said he couldn't breathe and there was no one around, but he was like right outside the hospital. So I didn't have a wheelchair or anything, but I ran inside. He was breathing and he was able to converse. So I knew he didn't need CPR or anything like that. But I ran into the emergency room and I got a bunch of emergency doctors and we all brought him in. He was fine. He ended up having just been discharged, and mental illness was more of the issue than anything else. But the fact that he said he was having heart problems and couldn't breathe, we got him into the hospital rapidly. So just the other day, when I was leaving the hospital, we helped get a guy the care he needed.
Okay, so we got a couple questions that people asked me. So the first one is, can you ask what type of internship and volunteer you did in high school?
Sure. So I did, I started in radiation oncology, which was actually a great experience because it was chronic care. And so you could, you met these patients for a long time and you could see how their therapy went. And I didn't really know anything about it. I didn't know that you had people who were physicists who were figuring out how to target the cancer tumor and stuff like that. So I found all that really interesting. So I started there, and then I had a couple family friends who were in medicine. So like a radiologist and a dermatologist that I shadowed, and just to see like what it was about and how much paperwork they were doing every day and all those like the kind of the everyday instead of the life-saving parts of medicine that everyone kind of thinks about. I wanted to think about how many charts you sign a day and how long you're at your office after hours and things like that. So I started doing those kind of things in high school.
Great. And then the second question was, would you recommend a BSMD program after high school?
I don't think it's a bad idea if that's what you want to do. I think it's kind of a great idea. I know a bunch of people who did it and really liked it, but they all knew that they wanted to be doctors. But with that being said, even if you do it, you can do all different types of medicine. So I don't think it's a bad option at all.
Okay. I hope that answered your question. And then we got a couple more as well. The next one's from Audia, and they said, can you ask what extracurriculars you did in high school?
Sure. So what did I start? So I was a competitive gymnast in high school until I had an injury. And then I was always involved in sports. I did track and field and swimming and diving after I couldn't do gymnastics anymore. I was the editor of my yearbook for 1 or 2 years in high school. I volunteered at a food kitchen. I tried to do it as much as I could as well. I volunteered at different places at Marin General, which was like the local hospital in our town, in our county. And I think that's the majority of things that I did.
Okay. And then the last question is really vague, but what are some pros and cons of being a doctor?
Oh gosh. Okay, good question. It is vague, but I would think that one of the cons is that it is a long road in order to finally, it's it's not instant gratification, right? Like you have to go to medical school, you become a resident, and then you become maybe you do fellowship, and then you become a physician. So achieving your, some people go to college and then they just become an investment banker, right? So it takes a really long time to have a career in that way, but it is a career all along the way. You're just a student for a lot of it, which can be a con for some people. I love learning, so it wasn't really a con for me. But along that path, you do miss out on stuff. You miss out on birthdays, you miss out on weddings, you miss out on all that kind of stuff a lot of the time because you're working. And as a resident, you work a lot. And so I would think those kind of things I would consider a con, just like the rest of life that you miss out on. But the pros of becoming a physician to me were worth it. I think being able to help others understand their care and help create better physical wellness for them is a great profession to have. I think of some of my friends, and a lot of them are really unhappy in the job that they have. And I don't think of myself as having a job, but I think of myself as having a profession in which I can help others, which is very, very rewarding for me.
Okay, that's interesting actually. And then we got a couple more again. So if you feel comfortable asking this, I was just curious like what your GPA was.
Sure. In high school or when?
Uh,
So many GPAs, gosh, so many.
yeah, I'd say like high school leading into your
I
freshman
think,
college.
sure, I think I had like a 4.3 with like my AP classes leading into college.
Oh, okay. Okay. Yeah, I was just curious about that. And then
Sure.
another one is from Akshara, and it was, what's the difference between a DO and an MD? And
Yeah,
are there any limitations to being a DO?
so I think DO is a great option. I actually applied to DO school, but at the time you couldn't practice internationally if you were going to become a DO. And I really wanted to, I knew I didn't always know, but I wanted to keep practicing medicine around the world as an option for me. That's no longer true. So I think that a DO is a great option in terms of practicing medicine. The difference is that you learn manipulative medicine as well in terms of body alignment, muscles, and bones and stuff like that, which I think is really important in terms of being a doctor. And I really wanted those skills. But I didn't choose to go down that route at that time because of the restrictions. But to my knowledge, and things are always changing. There's no differences anymore. And I remember when I was a medical student, there was a bunch of DOs who were in MD surgery residencies, and now everyone that I work with, MDs and DOs, everybody's the same. They just have an extra skill set that I kind of wish that I had.
I hope that answered your question, Shara. And we have time for about one more question. So if there's anyone that has like a question that hasn't been answered yet, go ahead and send it to me or raise your hand. Okay, it looks like everyone got their questions answered. So I just wanted to thank everyone for joining us today, especially you, Dr. Lieb. And most importantly, thank you for giving us a glimpse into your life as an OBGYN. And I can tell from like how our membership reacted during this meeting that they were definitely interested in your area of expertise. So we are honored to hear from you and benefit from your experience. And your career trajectory definitely showed a unique perspective in the medical field, and I know that you have inspired a lot of us to learn more. And I also want to express my appreciation for Mr. Chow, who's our advisor, who helped us launch this organization and is supporting us on many fronts. And I encourage any of you to suggest future speakers for our seminars based on your interest areas in the future. And that's it for everyone. See you at the next meeting. Thank you.
Thank you guys so much. I think this is such a great thing that you're doing in order to figure out